My name is Alfred Mahr. I'm a professor of internal medicine and I work in the clinic for rheumatology at Gall Cantonal Hospital. I have a PhD degree in epidemiology and public health. I have from both clinical and scientific perspectives a long-standing interest in a group of rare rheumatic diseases called vasculitis. We are one of the 23 participating partners of a Horizon 2020 grant named HELICAL. It's a Marie Sklodowska-Curie innovative training network that provides funding for 15 early-stage research students who receive state-of-the-art training in data analysis. HELICAL stands for Health Data Linkage for Clinical Benefit using autoimmune vasculitis as a paradigm.
My name is Solange Gonzalez Chiappe. I am a medical doctor with a master's degree in public health. By the end of 2019, I was selected for the PhD position at Gall with the HELICAL ITN grant. My term started in May 2020 and funding is provided for 3 years with the aim of obtaining a PhD degree.
The specific project we are working on here in Gall is entitled Focused Study of the Environmental Impact on Development of ANCA-associated vasculitis, a hypothesis-driven approach. ANCA stands for anti-neutrophil cytoplasm antibodies. ANCA-associated vasculitis is a rare and potentially life-threatening disease in which ANCA are commonly found in blood samples of affected patients. Here in Gall, we are trying to find out about the environmental exposures that might be involved in the development of ANCA-associated vasculitis. So far, not much is known about the environmental exposures that might cause ANCA-associated vasculitis. The clinical presentation of the disease itself suggests that the disease may be triggered through agents that enter the body through the respiratory tract.
My mission is to set up a case control study. We use information from people with ANCA-associated vasculitis and from controls of similar age and gender who don't have the disease. The main scientific difficulties are inherent to the rarity of ANCA-associated vasculitis. This implies that the study requires the collaboration of multiple national or international centers to gather sufficient number of patients to generate meaningful results. The selection of the appropriate control group is also very important, and we currently explore strategies to get access to information on environmental exposures in the general population in Switzerland.
The Horizon 2020 grant provides us with a great opportunity to get more insight in the impact of environmental risk factors in ANCA-associated vasculitis. Studying the environmental causes of diseases is very important because they're modifiable and preventable and potentially treatable in some instances. The current study will likely raise more questions, such as about the interaction between the environment and genetic background, or the possibility that specific exposures are linked with particular presentations of ANCA-associated vasculitis.
For me, the Horizon 2020 grant represents an excellent opportunity to improve my scientific skills by closely interacting with clinical experts, data scientists and data governance specialists. The interactive training network also includes 1 or 2 periods of traineeships at sites of other partners of HELICAL. This grant therefore represents a framework for obtaining a PhD degree, for conducting field research, for getting teaching courses, and for getting to know other young and senior researchers from many places over Europe.